Spinal stenosis. What is it? Well, let's take a look at spine. We know what that is. Stenosis. Stenosis is a narrowing of an opening. Okay, so spinal stenosis, you have a normal spinal canal where the spinal cord comes down through, right? Now, here is spinal stenosis. This is stenosed, where the canal now has been narrowed. And what's going to happen over time, if it continues, is that it's going to put pressure on the spinal cord. And then some of the other symptomology that we talked about with other conditions is going to happen here too. You can get radiculopathies, you can get pain, motor, those kind of things. It can develop to a surgical intervention to where the surgeon will go in and try to remove the stenosed area, get rid of that extra bone. It's not an easy surgery for the spinal canal. It's pretty serious. What can chiropractors do? At a certain point, there's nothing that we can do. Depending upon if it's a pathological or a genetic issue, as far as the body wanting to lay down the bone in the spinal canal and stenose a foramen, an opening. Okay, but in the beginning, we can help with movement. But I honestly, clinically, I've had a number of patients with stenosis, and none of them needed surgery. None of them were to the point where they were having consistent, constant radiculopathy, pain, and to where it affected their ADLs. We had other subluxations that did that. But as far as when we got them straight, they had stenosis. It was diagnosed as stenosis, but they weren't asymptomatic, but it wasn't affecting their ADLs, their activities of daily living. So that is spinal stenosis.